I'm Linda Elsiegood, founder of the LDN Research Trust. I'm very excited to tell you about the pain seminars we're holding in October. The seminars will examine the specific conditions for which LDN has shown to be an effective, non-opioid treatment for patients experiencing moderate to severe pain, including complex regional pain syndrome, fibromyalgia, neuropathies, back pain, and autoimmune diseases. In addition, LDN's unique ability to control pain in opioid-dependent patients and assist in the tapering and elimination of opioids will be reviewed. Thursday, October the 10th, at Lawrence Memorial Hospital in New London, Connecticut, for doctors, nurses, nurse practitioners, physician's assistants and patients. Dinner and refreshments will be served from 6 p.m, free admissions, presentations from 6:30 to 8:30 p.m. by pain specialist Dr. Neil Mehta. His presentation is called Alternatives to Opioids, Can We Do Better with LDN? And Dr. Sarah Zieldorf, who's an MD, researcher and patient, her presentation is called LDN, Treatment of Inflammatory and Autoimmune Conditions. Linda Elsiegood from the LDN Research Trust will be talking about the aims and goals of the Trust. Pharmacist Christian Steller from Precision Pharmacy will be available to answer questions on ultra and low-dose naltrexone and drug interactions.
Thank you for the opportunity. My name is John Kim. I'm a compounding pharmacist and owner of Robinson Drug and Compounding Center in Mendham, New Jersey. So low-dose naltrexone has been one of the profound treatments that we've actually found in terms of helping patients with many chronic conditions, such as pain and inflammation, Hashimoto thyroiditis, autism spectrum disorder, some of the autoimmune disorders that patients might be suffering from, including multiple sclerosis, as well as Crohn's and ulcerative colitis. The science behind low-dose naltrexone has to be educational first, that we need to relate to some of the medical professionals as well as patients, because initially naltrexone was a medication that was approved for treatment for opioid addiction and alcoholism. And in 1985, while working in an addiction clinic in New York, there was this physician named Bernard Bihari, MD. He actually discovered a novel use of naltrexone, which is a tenth of a dosing of a typical 50 milligrams in treating many conditions that patients suffering from, such as the chronic pain, autoimmune disease, and central nervous system disorders. So the science behind naltrexone is that it is a mu-opioid antagonist that is a mixture of two distinct shapes known as the isomers. And research found out was that it is able to sometimes actually balance out the immune cells, but it also helps to help release the endorphin systems by lessening the pain. It downregulates inflammatory cytokines while increasing T cells and natural killer cells, stimulates mucosal and tissue healing, directly inhibits tumor growth, at the same time reduces death of oligodendrocytes that may end up having to produce myelins in the brain. So there's a lot of a benefit in terms of helping with the nerve issues that patient might be having. And LDN, or naltrexone, also helps to block some of the opioid receptors, non-opioid receptors in the body, such as toll-like receptors, or TLR4, which is thought to actually has a direct anti-inflammatory effect in the body. So this can be very helpful for reducing severe symptoms of such inflammatory conditions as fibromyalgia, Crohn's disease, multiple sclerosis, and some of the complex regional pain syndromes. Some of the side effects the patient might be having when taking LDN or naltrexone, some of the common side effects could be sleep disturbances, vivid dreams, gastrointestinal upset or nausea, mild headache, and as well as a mild agitation when they first initially started. Uncommon side effects could be flu-like symptoms, rash, high temperature, dizziness, and increased fatigue or spasticity. But when you end up having to work with a reputable compounding pharmacist, as well as practitioners who are well educated in this aspect, in dealing with the patients directly and customizing the whole therapy is really vital in terms of patients' success in terms of using low-dose naltrexone. Now, some of the things that patient might end up having to look at in terms of looking at the dosage adjustment, especially looking at the liver enzyme needs to be checked before starting, as well as patient's kidney function needs to be monitored. And those are a few things that are very vital before starting it. Now, in terms of naltrexone, there are a few dosage forms that you could start with. Low-dose naltrexone is not commercially available at this time, so you need to actually work with a compounding pharmacist. And there are 4 dosage forms that we recommend that we've done before. It could be liquid. It allows a slow titration of optimal dosing. Capsules, is a very appropriate dose. Sublingual drops, where patients who actually have trouble swallowing or they have trouble absorbing certain medication. So sublingual drops could be very vital for them, as well as topical creams where kids with autism, where they're not able to swallow pills or swallow liquids, you can end up having to apply the medication topically to get the medication absorbed. And so last thing that we wanted to address is LDN can be very helpful for many issues, and as well as the fact that there are at least over 250 indications that are coming out, as well as studies that are published. And again, this educational portion is really, really vital for a successful treatment, but also it gives your patients, as well as yourself, a new tool as well as new solutions to treat complex diseases that we mentioned before. So thank you so much, and hope you join the LDN conference this October.